Hello, my name is Raj Pandya. I am a medical director at ARUP Laboratories and also an assistant professor of pathology at the University of Utah. Thanks for tuning in to this webinar. We are going to talk about interferences by dietary supplements in laboratory assays. So let's get started. First of all, disclosures. I have nothing to disclose, although I would like to say that if there are any vendor or brand names mentioned in this presentation, those are only for educational purposes. I don't intend to promote or demote any companies or organizations. So these are the objectives that we will cover. So first of all, we will provide an overview of analytical interferences in laboratory assays. Secondly, we will talk about potential interference caused by mega-dose biotin and vitamin C supplementation. And lastly, we will discuss strategies to detect and even mitigate such interferences if needed. So let's start the talk by asking the question, what is analytical interference? So analytical interference is a cause of medically significant difference in the test result due to the effect of another component or property of the sample. And broadly speaking, they can be categorized into two buckets, endogenous interferences such as bilirubin or hemoglobin, which are physiologically occurring substances, or it can be put into the bucket of exogenous interferences. So these are the substances that originate outside the body and can include things like a drug or its metabolites, specimen preservative, or a sample contaminant. So why are interferences a concern, right? Interferences can affect the accuracy of the test result, and they can cause a shift in the negative or the positive direction for the test result. And depending on the magnitude and the direction of the error, it can lead to potential misclassification of the patient, and that can include and influence medical decisions, right? That's why interferences are a concern for patient care. So now let's talk about dietary supplements before we dive into their role as interference, right? So there are two major categories of dietary supplements. They can be either defined or complex, right? So defined supplements have very specific composition, and these can include things like vitamins or minerals. And as far as complex dietary supplements are concerned, these can include substances that are more complex in nature, and these are things like energy drinks, turmeric powder, blueberry extract, ashwagandha, just to name a few. Now, dietary supplements are consumed by individuals for health benefits. These could be prescribed to correct a nutritional deficiency, especially vitamins and minerals, or they can be bought over the counter by healthy individuals to promote and sustain good health. So, as far as dietary supplements are concerned, here in the United States, the market is significantly large. On the x-axis here, you can see are the years, and on the y-axis is the market size. As you can appreciate, the market for nutraceuticals, also called dietary supplements, is increasing over the years. And at the moment in 2023, the market size is close to $100 billion a year. So that tells you that a significant number of individuals might be using some of these nutraceuticals / dietary supplements. So, with that introduction in mind, let's now dive into the specifics of two dietary supplements that concern laboratory professionals. So, the first one we'll talk about is biotin, and the second one is vitamin C, also called ascorbic acid. So, biotin is also called vitamin B7. It is a coenzyme which is involved in multiple metabolic processes, including carbohydrate metabolism and fatty acid synthesis, amino acid catabolism, and gluconeogenesis. So, as you can appreciate, this vitamin is really important for energy production and energy maintenance as well as energy storage. Now, the daily recommended diet to sustain good health is up to 30 micrograms per day. However, over the counter supplements are available that can go up to 100 milligrams per day. So, see the difference in the units 30 micrograms versus 100 milligrams. Supplements are available. Now, supplementation might be necessary for medical purposes when some individuals rarely are biotinidase and carboxylase deficient, or if they have peripheral neuropathy. In these cases, supplementation by biotin is required. However, many of the supplements are marketed as promoting nail and hair health and improvement in the nail and hair growth. So, actually, there is little to no evidence to support that in non deficient individuals, biotin supplementation improves this. So, it is important to make that note. Now, as far as we are concerned as laboratory professionals, how does biotin interfere with laboratory assays? So there are some immunoassays used by major vendors that exploit biotin streptavidin interaction to immobilize or to capture antibodies in their immunoassays. And here is an example of the immunoassay. The design of this immunoassay is of non-competitive type. So let's walk through the assay design. So this is a biotin-free specimen, let's say from a patient, and the red circles here is the analyte of interest. The gray antibody is the detection antibody. This antibody here in the Y shape is a biotin tagged antibody, and the blue hearts are basically streptavidin coated beads, right? So in this non-competitive design, the biotin labeled antibody gets captured by streptavidin coated beads, and the analyte of interest binds to the capture antibody, which is then detected by the detection antibody after the sandwich has formed. And as you can appreciate, the more detection antibodies that bind to the analyte of interest, the more signal is generated, which means that the analyte concentration is directly proportional to the amount of signal that's generated. Now, this is a situation where there isn't excess biotin in the sample. But now, if you have excess biotin in a patient specimen, and you can see these pentagons here, those biotin molecules can actually bind to streptavidin coated beads and and capture those sites, which are actually meant for the biotin labeled antibodies to bind. And in this case, as you can appreciate, much fewer antibodies are able to bind to streptavidin, which leads to much fewer sandwiches being formed, and that leads to much lower signal generation. Now, since this is a non-competitive immunoassay design, and the signal is directly proportional to analyte concentration, lower amount of signal means falsely low detection of the analyte of interest. So now, after talking about the non-competitive immunoassay design, let's also talk about competitive immunoassays. So here is the assay design. So in the first half, or in the top half, we can see this is a biotin-free specimen, but instead of having a detection antibody, we have analyte, which is tagged. By a detection system, right? So this here, these red circles here are unlabeled analyte, which is present in the patient specimen, and this, which is labeled analyte of interest, which is part of the assay system. And here we have the biotin labeled antibody, and the blue hearts here are again streptavidin-coated beads. In the absence of excess biotin, there is a competition between the labeled analyte, which is part of the assay system, and the unlabeled analyte, which is present in the patient's specimen. And the more the detection or labeled analyte that binds to these antibodies, it means there is fewer analyte molecules present in the patient specimen. So this is indirectly proportional to the analyte of interest in patient specimen. Now, when there is biotin supplementation and it's present in excess amounts, this biotin can capture the streptavidin-coated beads, and much fewer capture antibodies are able to bind, leading to low signal generation. And this low signal corresponds to a high analyte concentration. So in this case, if there is excess biotin present, then it can be interpreted as falsely high analyte being present in the patient specimen. So now, what assays could be affected by biotin overdose? So here are a few examples. They can include troponin, as well as endocrine assays such as follicle stimulating hormone, total T4, thyroglobulin, some infectious disease testing assays such as hepatitis A virus, immunoglobulin M, and even tumor markers such as CA19-9. Now, it is important to keep in mind that these analytes are affected when measured using an assay that depends on the biotin-streptavidin interaction. There are assays out there in the market that do not use this system, and therefore those are unlikely to be affected by biotin, and therefore it is important to keep in mind to refer to the package insert to make sure that you understand the assay design. Now, after talking about biotin, now let's talk about vitamin C, also known as ascorbic acid. So vitamin C is an antioxidant that helps protect cells against free radical damage, and it also has other functions. For example, it can help our bodies to convert fats into energy, as well as help with synthesis of collagen. It also supports our immune function, and it can keep the nervous system healthy as well. Now, the daily recommended intake of vitamin C is up to 120 milligrams. But similar to biotin, much higher doses are available in the market over the counter. And this can go up to 1,000 milligrams. So again, supplementation of vitamin C might be medically necessary for some specific cases, such as for certain individuals who are on chemotherapy for cancer, patients who have sepsis or burns. But as far as supplementation for promoting health is concerned, there is actually very limited evidence that vitamin C helps shorten the duration of cold, as well as there is also very limited evidence to suggest that overdose supplementation of vitamin C lowers the risk of developing cataracts. So that's important to keep in mind. Now, let's now talk about how vitamin C can affect laboratory assays, because as laboratory professionals, that's what we are interested in. So I'm now going to share a case study that we encountered in real life in our laboratory. So we got a specimen from a 58-year-old female from a wellness clinic who had a lipid panel ordered. And the testing was performed on a Roche Cobas C502 platform. Um, the results got flagged, and so the laboratory sent the results for medical director review. This is what the results look like. So we have triglycerides, total cholesterol, HDL cholesterol, as well as LDL cholesterol, which is a calculation. As you can see here, the triglycerides and total cholesterol values looked very abnormal. Triglycerides were 0 and total cholesterol values were -8. And since the LDL calculation depends on triglycerides and total cholesterol value, that could not be calculated. So before we dive into solving the case, let's let's examine the reaction chemistry for triglycerides. And it's important to note that the reaction chemistry for cholesterol is somewhat similar to triglycerides. So as you can appreciate, looking at this slide, that the assay is a multi-step enzymatic reaction, right? That starts with triglycerides and goes through a variety of steps. And then it ends here, right, with dihydroxyacetone production. And when dihydroxyacetone is combined with hydrogen peroxide in the presence of this enzyme called peroxidase, um, it produces a colored compound, also called a quinonimidine dye, which has an absorption maxima around 500 nanometers. And that's where the detection happens. This part of the reaction is called Trinder reaction. Now, if there is excess amount of antioxidant, such as vitamin C present in the patient specimen, you can appreciate that it can neutralize this very important hydrogen peroxide, and that neutralization can lead to a falsely low dye production and a falsely low signal, falsely low analyte concentration. So we took this specimen and actually ran it through an assay, which is validated in our laboratory on an HPLC platform. And as you can see on this chromatogram, we saw a very large peak of vitamin C, which quantitated at 4,501 micromoles per liter of vitamin C compared to the upper reference limit of only 114 micromoles per liter. So there is just a very large amount of vitamin C concentration in this specimen. Now, how could an outpatient achieve such a high concentration of vitamin C? So if you take one of these tablets that are available, which are 1,000 milligrams, if one takes 4 tablets, and considering they have 5 liters of blood, they would get a concentration similar to this. As you can appreciate, that would be overdosing of vitamin C. Now, this was a case of a patient specimen, but we wanted to verify if vitamin C supplementation actually affects these assays, right? So what I did is we took vitamin C spiked serum at different concentrations. Here we have the control. Next, we have vitamin C at 50, 500, and 5,000 micromoles per liter concentration. Um, which we spiked into a serum that did not have vitamin C. And as you can appreciate, the values of the test, so total cholesterol and triglycerides, dropped as the vitamin C concentrations increased. Now, what's worrisome here are these two uh, bar graphs, right? So for total cholesterol and triglycerides, they are worrisome because they slightly lower the values of these tests as opposed to these last columns that dramatically show a reduction. So why is this concerning? It is concerning because while a drastic change may be obvious and it would be flagged, but if the values become normal from previously abnormal, that might go unnoticed and it might even be taken as a positive sign both by the patient and perhaps their clinician. So that's something that is concerning for laboratorians and in terms of patient care. So the next thing we examined is this an isolated case, right? So our laboratory does provide vitamin C measurements. We have a validated assay. So we looked at specimens, about 29,000 specimens that were sent for vitamin C testing, and we found that approximately 0.61% of those specimens, and in actual numbers, it is about 175 specimens, had very high vitamin C concentrations that ranged from 500 all the way up to 25,000 micromoles per liter. So again, that's a very high vitamin C concentration. Now, again, the question is which assays might be affected by this vitamin C overdose, right? So as we saw, certain analytes in the lipid panel might be affected, uric acid, as well as enzymatic creatinine might be affected. All three of these are assays that depend on Trinder reaction. So that involves that hydrogen peroxide to produce color. Now, in addition to these Trinder reaction-based assays, other assays such as potentiometric assays for electrolytes, as well as urine dipstick tests such as those for nitrites, bilirubin, glucose, and hemoglobin might also be affected. Some point-of-care glucometers are also affected by vitamin C interference. And as you can see here, there are published case reports on unintended consequences of high-dose vitamin C therapy on an oncology patient, and significant misdiagnosis and significant impact to the patient has been noted because of this. So now, what are the solutions, right? So there are some signs of assay interference that we as laboratory professionals should be aware of. The first is delta flags without any obvious clinical or technical explanation, non-physiological results, such as the ones we saw, such as negative values or values close to zero, non-linear dilutions, as well as concerning inquiries from clinicians, questioning the validity of the results. So how can you prevent and mitigate these interferences? So these are some strategies that one can employ, taking into consideration regulatory requirements. So pre-collection questionnaires that can be asked to the patient. Again, clinician and patient education can be provided, so that they are aware that certain dietary supplements can interfere in laboratory assays. When interferences are suspected, chartable notes can be included. Recollection can be suggested if the patient is on a supplement that is known to cause interference. Recollection can be requested after the patient has stopped taking that supplement, specimen can be serially diluted uh, in cases of overdose of biotin, and even a different platform that is known to be not affected by certain interference, such as biotin. It can be utilized. In addition to these, uh, there are devices available in the market that can help with, for example, biotin detection. This looks like a pregnancy test kit that will give you a yes or no answer uh, as to if there is biotin present above 15 milligrams per ml in the sample. There are also devices available to pre-capture biotin and then use the sample. And there are some published reports as well that describe pre-conjugation strategies to eliminate interference from biotin. As far as vitamin C is concerned, we employed a strategy of using test strips to detect vitamin C in the patient sample. As you can see here, this is control serum which does not have vitamin C, and then we spiked increasing amounts of vitamin C, and you can note the change in color of these test strips, which can indicate that there is vitamin C present. Um, so spiking vitamin C externally is one thing, but we wanted to also see if our patient, the case study that we presented, if their vitamin C could actually be detected by this test strip. And interestingly, it can be. You can see this is a control, negative control, this is a positive control, and at the very bottom, we have the patient sample with a very high concentration of vitamin C. Not only can you detect vitamin C using these test strips, one can also employ an enzyme called ascorbate oxidase, which neutralizes vitamin C. So, as you can appreciate here, this is a no vitamin C control. This is a positive vitamin C control. And this is our patient sample that was treated with ascorbate oxidase. You can see that vitamin C got neutralized. The test strip became light green from dark blue. Um, and in this specific case, the client who had sent the specimen was notified of the interference, and only those test results, such as the HDL cholesterol that were unaffected, were reported. It is also important to note that the strategies that I talked about for detecting and mitigating interferences would have to be employed within a regulatory framework. So I highly recommend that you refer to your regulatory guidelines for how to implement uh, these strategies. At the very least, a thorough validation is required for clinical testing. So we are at the last slide. These are a few key takeaways from this presentation. So first of all, interferences in laboratory assays can affect medical decision making. Um, Certain dietary supplements, such as biotin and vitamin C, may affect laboratory assays. High dose biotin can affect immunoassays that are dependent on streptavidin biotin interaction. Remember, not all immunoassays depend on this interaction. So please refer to the package insert. Vitamin C can also affect laboratory assays because of its strong reducing potential. It can affect both laboratory assays as well as point of care instruments. And as a result, laboratorians need to be aware of some of the hallmark signs of assay interference, such as delta flags. So what is important? What's really important here is a clinician laboratorian communication when unusual test results are encountered. That can reduce patient impact arising from assay interference. And having said that, there are limitations, right? Not all interferences are possible to detect and identify. And in those cases, we might just have to rely on creating a questionnaire before sample collection that asks the patient, are you taking any health supplements? And if the answer is yes to known interfering dietary supplements, the only solution might be to have them stop taking it for a certain duration and then request a recollection. With that, I would like to thank you for your time and attention. Please feel free to drop me a question or a comment, and I'm happy to respond to it. With that, thank you and have a nice day.